providing resources and comfort to caregivers. This is Caregiver Crossing.
Hi, everybody, and welcome to Caregiver Crossing. Thank you all so much for being here. It is a beautiful autumn that we're having, and we're glad you're here with us. Caregiver Crossing is a show that's brought to you by Joyce House, presented in partnership with Cardon and Associates. And we're here with you every week to talk about all things caregiving. Tina McIntosh is not here this week. I'm Terry Stacy, along with producer Noah Taylor.
Hey there.
Hi, Tina. Hi.
Hey, hello. How's it going? Guess what, Terry?
We've got a special guest.
We really do. We have our special guest back this week who is filling in for Tina.
She's so good.
She's incredible. Angie Light is the founder and CEO of Radius Care and Radius 10.
Why choose a Sleep Number smart bed?
Can I make my site softer?
Can I make my site firmer?
Can we sleep cooler?
Sleep Number does that. Cools up to 8 times faster and lets you choose your ideal comfort on either side. Your Sleep Number setting. Enjoy personalized comfort for better sleep night after night. It's our Black Friday sale. Recharge this season with a bundle of cozy, soothing comfort. Now only $17.99 for our C2 mattress and base, plus free premium delivery. Prices higher in Alaska and Hawaii. Check it out at a Sleep Number store or sleepnumber.com today.
And she has been a very, very long time friend of Joyce House and supporter of Joyce House and everything that we do here. And she has been a fantastic leader of healthcare in our Indianapolis community and helped so many families through their caregiving journeys. Angie, thank you so much for being here.
Angie.
Thanks, guys. I'm so excited to be here, and I'm so honored to
Just
be
such
here.
a great voice. It's got a little husk to it.
Oh, I've had that since I was a child.
I
used
it.
to actually hate my voice, so the fact that I do this
Oh.
today is just so awesome.
It's great.
It's a good pairing because you've got the voice for radio and I've got the face for radio.
Noah, you are quite handsome.
Yes, you
Well,
are.
Thank you. You're too sweet. I saw something really cool on TikTok. You guys might have seen this, but it was a video of a Colts cheerleader talking to a young fan who's deaf. And
I did see that.
Yes.
It was a
the
great
cheerleader was
video.
talking to this young man with ASL and able to talk to him and really be able to get his interest going in the Colts game. And it was really beautiful.
It just helped him he felt included.
Yeah,
Yes,
the
exactly.
The
cheerleader.
cheerleader was talking to him.
Yes, specifically to him to be included. And this cheerleader noticed he's 8-year-old and he's a deaf fan. And he was holding a sign. So this cheerleader noticed it. And then she actually started signing back to him in American Sign Language. And it was a very short exchange, but it's very beautiful. I saw the video on TikTok and it made national news for all the right reasons.
Yeah.
Absolutely.
I loved it.
That's so cool.
I loved it. I love seeing it too. And I wish I knew sign language. I wish I do. I remember watching one of the first most impactful films I ever saw as a kid was Helen Keller. Was the film Helen
Yeah.
Keller.
Oh,
Yeah.
yes.
Really old by now, I'm sure, film that was there out. But
Everyone should watch that.
oh
film.
my gosh,
I agree.
everybody should
Yeah.
watch that film.
Yeah.
Just heart-wrenching and beautiful. And anyway, Helen Keller.
All the
but
feels.
all the feels. But from that time on, it feels like I remember my memory. I knew it maybe for a minute, but now I can just, okay. And, just a few little things here and there. But my gosh, it would be such a good thing to know.
Yeah, I wish-
We're all
Yes.
learning languages right now. Japanese, the number one here in Indiana. More of us want to learn
Wow, I
to speak
didn't know that.
Japanese, which is very hard, I think, as
That's
a
super
second
interesting.
language. But sign language should be included too.
I agree.
Maybe we all
100%.
learn that a
My
little bit.
my high school had Spanish and French. Maybe they do have an ASL class now. I mean, it's been a few years, but I hope they do. I hope they are teaching that to students. I think that would be a wonderful thing, so that we can include everybody in our conversations.
Super important.
I think this conversation is really important for our caregivers too, because they are often the ones who are supporting people who do communicate differently. I mean,
Right.
maybe those people are deaf, but maybe they have a dementia diagnosis. Maybe they have another diagnosis where it's hard for them to communicate. So I just think it's a very important message for our caregivers. That connection doesn't always come from words. It comes from meeting people where they are.
That's right.
And there's so many aspects of your body language and other things too that you should pay attention to when your loved one has a diagnosis like this.
Yeah. I'm thinking to myself right now how often I see people downtown where I work signing to one another. And it's far more frequently than I've ever seen before, I will say. that I'm seeing that language being used to speaking to one another through sign language, whether that's even at a protest, as I'm
Right.
driving and I
Yeah.
see there's a group that's signing, or, if I'm at the grocery store downtown, or there are more people downtown and we have all of the things. And so you're seeing more of everyone
Which
coming downtown.
that's great.
I'm just seeing it more.
Yeah.
Seeing it more as opposed to when I was younger. Okay, so this is Caregiver Crossing. We're glad that you're here today. Around 15% of U.S. adults report some degree of hearing loss, and that number doubles after the age of 70, since we're talking about hearing loss. And, it's one of those things that you don't want to admit,
Yes.
because that's a sign of getting older. But truly, communication between myself and my husband has gotten very weak, even if he's behind me in another room. And we're
Is
right
that
there
because of
with
the hearing
or
carrier?
is
Is that
right.
is that
Is it because of your relationship?
Maybe it is just
It's a little
after
bit of
all the
both.
years now, it's selective hearing. But
because I think we all have that.
I do think,
I do have a
in
little
this
bit.
day and age, my goodness, guys, everybody's wearing
Yeah.
AirPods, or, has something in their ears. And
Which, speaking of earpods, in nursing school, I studied about the ear, and our regular frequency is like negative 70 MVs, is how they put it. And when you have earpods on, it's 120, negative 120, which is almost as a plane taking off. So you think about the damage that we're actually doing to our ears. It's kind of crazy
at a young age.
at a young
At a
age.
very young
So
age.
if you're an investor, you might want to invest in hearing aids right now, because they're going to have to. I mean, kids
That's right.
are losing their hearing
Quicker.
at such early ages now.
Yes. I mean, if we're comparing that to a jet taking off and we're doing
That's
it every
terrible.
single
Every
day.
single day,
It's terrible.
like multiple times a day.
Yeah.
as
And how many
well.
times do we turn up that volume on our phone?
I will
Oh
say,
my
like,
gosh,
yeah,
yes.
My
Yeah.
headphones are on probably a third of
Same.
the day. Yeah.
Same.
And you probably got them up higher than they probably need to be.
I always do.
I'll bet
I
you.
listen to my music way too loud, but this is a reminder that maybe you can turn it down a little bit today.
That's
You can
right.
turn it down a little bit, or
gentle
like
reminder.
me, check into what investment you can get into when it comes to hearing aids, because they're going to be. That's gonna
And
be
start learning
a
sign
great
language
investment, and start learning sign language now. All right. So what did you plan for us on the show today, producer Noah?
Well, we've got we have actually a very big person coming to talk
big
to
person.
us. Maybe that's not the right word. Dr. Singal, who is with Innovative Hematology, and he's an adult hematologist, and will be coming to talk to us about anemia today.
Hey, I
You
was
are so
anemic when I was
funny.
in college, so I'm interested to hear this. Talk
Were
about it.
you?
I was.
How did you get yourself out
I
of it?
actually passed out.
Oh my gosh.
Yeah.
And that's young.
Yeah, and hit my head. So, yeah, I haven't had any problems ever since, but it was
So we're
a
doing
young
this like a
age.
checkup for you to see
Yeah,
how you're
I don't
doing
even
after
remember.
all these
To be
years.
honest, I don't remember what the reason was or what happened or even how I got past it. So, be
That's not a
interesting
good
to,
sign.
Yeah,
That
right,
you don't have
yeah.
any memory
Yeah,
of this at all.
That could have been that.
This could have been a dream. This never really happened to you at all. She had a dream. Okay, should we take a break, Noah?
I think it's time to take
All
a break.
right, let's
but
take a break, but we'll be back with Noah's giant guest.
You can find past episodes of the show at joycehouse.org, and be sure to like and follow us on Facebook. If you'd like to connect with us to discuss show topics, need help connecting with resources, have a question that you'd like for us to answer on air, or just want to say hey, you can reach us at joycehouse.org, or you can email Tina at joycehouse.org. All right, stick around, everybody. We'll be right back with more Caregiver Crossing right after the break.
Welcome back to Caregiver Crossing. We are your hosts, Angie Light, filling in for the awesome Tina McIntosh, Terry Stacy here, and we have Noah Taylor, our amazing producer. Today we are joined with Dr. Mukal Singal, an adult hematologist at the Indiana Hemophilia and Thrombosis Center. Dr. Singal is a board certified in hematology and has special expertise in conditions related to blood health, including anemia, bleeding disorders, and iron overload. He's here to help us understand the signs of iron deficiency and why this common condition is often overlooked. Dr. Singal, thank you so much for being here.
Thank you for having me.
Doctor, can you tell us about your practice and the kinds of patients that you typically work with?
Absolutely. I'm very thrilled to talk about our practice just because we are not only unique in what we do, but also how we do it. Uh, Innovative Hematology is the largest hemophilia treatment center uh, in the country, or I should say one of the largest, but it's the only HTC in Indiana. Uh, we are one of the largest collections of classical hematologists in the country. And what we do is we take care of people with blood disorders, which could be as varied as low cell counts, which could be anemia, low platelets, or low white cells, to something on the other end of the spectrum, such as increased cell counts, which sometimes can be leukemia, and anything and everything in between.
Mm.
What we are known for is for the management of bleeding disorders and clotting disorders. So we are also the Indiana Hemophilia and Thrombosis Center. Hemophilia refers to the bleeding disorders component of it, and thrombosis represents all the clotting conditions that can occur. And we are a little unique in that we cater to a state where there is a big Amish population. Uh, there is also a huge sickle cell population, and we are renowned for not only bleeding disorders, but also the care of sickle cell disease. And we hold outreach clinics in the peripheries of the state, and our nursing staff goes to patients' homes or to other centers to give them products when they have acute issues or when they're going in for surgeries, etc. So we are sort of unique in what we do.
Yeah, unique in the sense that, yeah, you'll make a home delivery.
I love
And
that.
I love that too. Dr. Siegel, iron deficiency anemia. I'm understanding that is the most common nutritional deficiency in our world. What makes it so widespread, even in countries with access to good health care?
No, it's uh, concerning as well as it's sort of mind-boggling how such a common thing is overlooked so often. But to your point, yes, iron deficiency is the most common cause of anemia. Uh, about a quarter of the world's population is anemic, give or take about 2 billion people, and
Wow.
two-thirds of those people have iron deficiency. Uh, Now, you raised a very valid question. Why is it so prevalent even in developed countries where the healthcare is good? And it's partly because of why iron deficiency develops, but then there are other issues as well. So, why it develops iron deficiency, the biggest cause of iron deficiency is people bleed. Women bleed every month when they have menstrual losses, but as we age, we can start bleeding into our gut as well. Uh, Rarely people also donate blood. And if somebody is donating blood very frequently, in addition to the other two things, that can add on to blood loss. The other thing is that people are not actually eating as much iron as they think they're eating. When I was growing up, I used to watch Popeye, and the sailor
Oh,
was getting a lot of
so
iron from
fun.
spinach. Yeah, but the truth is that back in the day, the show started because they miscalculated the amount of iron in spinach, but also we have a greater recognition now that uh, the iron in green leafy vegetables is not as well absorbed as the iron in heme or red meat, just because there are oxalates and calcium in the plants and this doesn't get absorbed. So people who have a vegan lifestyle,
Yeah.
a vegetarian lifestyle, they are at risk as well. The other thing is you might be eating a lot of iron, but you may not be absorbing much, and people have perhaps undergone weight loss surgeries. More commonly, people might be taking antacids because of gastritis, and these
Mm.
impair the absorption of iron. And lastly, people require more iron in growth spurts. So as kids are increasing in size in their puberty, the requirements increase, or as women are pregnant, they need to give almost a gram of iron to their baby. A gram of iron is the iron in 5 units of blood. So if somebody is pregnant very closely together, or if somebody is having a lot of pregnancies, they are again at risk. So all these things, they put people at risk irrespective of whether they're in a developing country or a developed country. And that's why people everywhere are at risk for iron deficiency.
Can you make up the difference in your deficiency through a supplement? I see so many iron supplements on the market. Can you make up that deficiency with a supplement?
Yes, yes, you can. And the thing about iron is that we've realized that if you're taking iron every day, you may not absorb as much as what you would absorb if you were taking every other day. Similarly, if you're taking it multiple times in a day, it's not great for absorption. Also, the side effects, gastritis, nausea, vomiting, constipation, they increase if you're taking it multiple times a day or every single day. So if you're spacing it out, yes, you can absorb it, but you have to keep in mind if somebody's losing blood very rapidly or again and again, or if somebody is not absorbing it to begin with, then oral supplements may not help out. The second thing, and that is sometimes ignored, people can be at risk for iron overload as well, especially men or women who are postmenopausal and who do not have childbirth or blood loss during menstrual bleeding. If they are taking iron supplements, they can develop iron overload. 1 in 200 people with a Caucasian descent have a mutation which can predispose them to iron overload. So I don't recommend over the counter supplements or iron supplements for everyone, though everyone may benefit, or most people will benefit from iron testing, so we can find out if they're iron deficient.
So, doctor, beyond that fatigue, what are some of the subtle or unexpected warnings that people tend to overlook?
That is the $1 million question, and that is another reason why people may not get diagnosed. Uh, Fatigue is very common, but how it proceeds is if I'm developing iron deficiency, first of all, my reserves, my stores of iron start going down. And at that point, I'm not anemic, but I still might have trouble with concentration. I might have fatigue. I might struggle in school or work performance. People can have mood changes, emotional disturbances. And as this keeps on getting worse, we also start getting anemic. Now, anemia means that the red pigment that carries oxygen in the blood, that is low, which means the body is not getting enough oxygen. And at that point, we are looking at worsening of the symptoms that I mentioned earlier, but also things such as getting short of breath when one is exerting, perhaps getting lightheaded if you sit up from sitting or lying down position very quickly, uh, or you might feel your heart is racing inside the chest. People, in rare cases, if it keeps on getting worse and worse, can have stress on their heart, which can lead to heart failure or uh, less commonly heart attacks.
Would you stick around with us for another segment?
Absolutely.
All right, wonderful. You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We're here every week to bring you support, education, and hopefully a good laugh. To connect with us, hear past episodes, learn more about caregiver support resources in the community, and much more, visit joycehouse.org. Don't go anywhere. We'll be right back with more Caregiver Crossing right after the break.
Welcome back to Caregiver Crossing. Hello again. Thank you much for staying with us. We are here with adult hematologist Dr. Singal, who is with Innovative Hematology. Doctor, thank you so much for sticking with us. Your information is so valuable.
Thank you for having me. Glad to be here.
Wonderful. So So, this question, if low iron is left untreated, what kinds of health complications can it eventually lead to?
Yes. So this is a multi-pronged answer. So before we went on the break, we were talking about how if iron deficiency gets bad, people are anemic, it can lead to less blood flow to tissues, including the brain, and they can have concerns about feeling faint. And in rare cases, it can lead to stress on the heart and heart attacks as well. But short of that, much before that, there are a few special things that I should mention, especially in women who are of childbearing age. If they are iron deficient and or iron deficiency with anemia, it can put it can have effects on not just the mother, but also on the developing baby. Uh, in terms of the mother, people who are iron deficient, they have a higher risk of having postpartum hemorrhage, that is bleeding when they deliver. There is increased risk of the baby being smaller in size,
Mm.
what they call IUGR, intrauterine growth restriction. There can be placental abruption, that is, the placenta gets removed from the uterus. So, all in all, the maternal morbidity or the mother's health is affected by this, but also the baby. Babies who are born to mothers with iron deficiency are thought to have side effects such as being small in size, but also there's a concern their school performance lags in early years compared to the peers whose mothers were replete with iron. So this is a uh, very at-risk segment, and we should be more careful here. The other group that is at a higher risk is people who are older, above the age of 65. And as we age, people can start developing kidney and heart issues. They can also develop trouble where they might have inflammation going on, and their body is unable to use iron as well as it should, and they develop functional iron deficiency, which has been shown can lead to worse health, but also an increased risk of dying. So these are some of the uh, common and uncommon major complications of iron deficiency.
Are There are so many opinions online about iron-rich foods and absorption, but really, what is the truth about what really helps the body absorb iron?
So there's a lot of facts and there's a lot of fiction. Uh, some of the facts: uh, eating iron on empty stomach increases absorption.
Oh,
Oh,
Iron
okay,
from green leafy vegetables is not as well absorbed as iron from meat.
okay.
Taking vitamin C with iron tablets can increase the absorption of iron, but it can also increase the side effects. So it's a double-edged sword.
Oh,
mm.
Having tea or milk products with iron tablets reduces absorption of iron. As I mentioned before, taking iron every other day and once a day and not multiple times a day is also more beneficial for absorption. Now, oral iron absorption can lead to GI side effects. And if somebody is having side effects, I would suggest taking iron tablets with food is better than not taking it at all.
okay. Is there a different what men and women should be taking different amounts?
So the amounts doesn't matter because the iron, elemental iron in a tablet ranges from 24 to 65 milligrams in a tablet. But most people who do not have hemochromatosis or who absorb too much iron, they usually absorb just 1 milligram out of the total amount.
Oh,
The
okay.
rest we pass on, and that passed on iron is what leads to the side effects. So the dosing is similar in men and women, but I must stress that people who are not iron deficient should not be routinely taking iron supplementation. The only people who should be taking iron supplementation uh, routinely is pregnant women, and the Centers for Disease Control suggests that women should have oral iron supplementation.
Okay. Angie?
Yeah, so doctor, one symptom that surprises many people is craving ice.
This is strange to me, or
Yes.
interesting, I should say.
Yeah, so
Craving ice.
craving ice. So what causes that and why is it connected to low iron?
The uh, answer is actually going to be a letdown because we don't really know. Uh,
Nope.
there are hypotheses as to why people crave ice and why people crave soil. So the most common craving is for ice or pagophagia, but the second most common is geophagia, the craving to eat soil. And one of the thoughts is that perhaps when we are iron deficient, the brain's dopaminergic system, which is associated with rewarding the body or also with
Is it?
drug addiction, actually, that gets a little affected, but nobody knows for sure. So I don't have a great answer.
No, but the answer was great because we didn't know anything about the craving of
Right.
soil.
Yeah, very
Which we
interesting.
hear,
Wow.
from pregnant women. Sometimes you'll say pregnant women will crave things like soil and odd foods too, but soil in particular.
That is
Dirt.
odd.
Yeah, mud. Well, let me ask you this, Doctor. Again, Dr. Singal is here, adult hematologist with Innovative Hematology. We've got you here. Let me check my clock. Oh, we're coming down to a wire here. We've got just a couple minutes left. How long does it typically take for somebody to start feeling better once their iron levels are being actually corrected?
So if somebody gets oral iron and they're not losing blood and they are absorbing iron well, they should have resolution of their iron deficiency and or anemia in about 3 to 6 months. Uh, if somebody is getting IV iron, the effects are faster. The first effects start coming in a few weeks. So between 2 to 6 weeks, people should have resolution. But I did add a lot of disclaimers there because if people are still losing blood, they may not get the benefit. The absorption may not be able to keep up with the losses, especially orally. If people don't absorb enough, then again, oral route is not really great. But with oral iron, in a few months, people should start feeling better. And with IV iron, people should start feeling better in a few weeks.
Doctor, thank you for being here today. How do we get a hold of you if anybody's interested in finding out more?
So if they search for Innovative Hematology Inc. or Indiana Hemophilia and Thrombosis Center, that will lead them straight to us and my amazing colleagues, and we'd be glad to help however we can.
Thank you so much. Thank you so much for taking time out of your day to talk to us. We've got to take another break. We'll be right back after this.
You're listening.
Thanks so much. Have a good day.
You
Thank
too,
you.
Doctor. Thank you.
Thank you so
Thank
much.
you.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We're here every week to bring you support, education, and hopefully a good laugh. Visit joycehouse.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much, much more. That website again is joycehouse.org. All right, don't go anywhere, anybody. We'll be right back with more Caregiver Crossing right after the break.
Hey, everybody, welcome back. Caregiver Crossing with you for just a few more minutes. Terry Stacy, along with Angie Light, filling in for the great Tina McIntosh, and also Noah Taylor, who produces today's show. Thank you for everything that you have done. Hey, guys, November. I can't even believe it's already November.
Is that right?
Seriously,
Is it November?
Yes.
The leaves have, I mean, truly, the leaves have now done it. They're
They're
turned
changing.
and they're changing, and it is beautiful. But
I was
yeah,
going to say,
it's
I
November.
think the leaves were confused for a little bit while
Well,
it was still so hot in the
That's
fall.
right.
But now it's beautiful outside. It's
Beautiful
truly
outside.
fall. It
It's
is truly
leaf
fall.
peeping time.
Leaf peepers. Put on your peepers and go
Yep,
leaf peeping.
Do it.
But November is a very special month here. It is actually American Diabetes Month, which is a time to raise awareness about prevention and daily management for those with diabetes.
I could be wrong. I don't know the numbers. Maybe one of you have numbers, but I feel like the numbers continue just to grow, and kids younger and younger are being diagnosed with diabetes. Something's not right.
Absolutely.
I mean, I think
Something's gone wrong.
I think that's very true. I think it's a lot of things. It's access to healthcare. It's access to food. It's probably about a million factors that are adding into it, and why so many Americans now have diabetes. It's actually about 38 million Americans
my
have
gosh.
diabetes,
Wow.
and nearly 100 million more are considered pre-diabetic, and many don't even know it,
Yeah.
which is the scary thing. But what I think is very important is that diabetes affects way more than your blood sugar. I mean, it can impact heart health,
Yes.
your vision, yeah, energy, and your mood as well.
I had an uncle that passed away from diabetes many years ago. And I remember watching his caregiver, his wife and his kids and everybody do everything they were supposed to do to manage it,
Yeah.
as a family,
Sure.
making sure and care and doctor's visits and all that goes into those that are living with diabetes. And it just progressively took his life. And I don't know if we have better systems in place right now or better testing, I mean, that was quite a while back. But with the numbers that look like they continue to grow, obviously when you give to diabetes foundations and organizations, there has to be so much research going on how to at least, I mean, it feels like we have all that we need to know, right, about prevention, but it's also in your genes, right? Is it?
It can be, yes. And I think too, educating young. So I think a lot of times, these are diseases, like you said, pre-diabetes. So this starts, a long time. So you have to really understand, how to manage that. And it's all about, the foods that you're putting in your body, the movement that you're taking, and making sure that you're monitoring those blood sugars. I think now we do have some great technology to monitor them a lot easier. And so you're in the know. But it also comes down to that choice of, am I going to make these changes to make sure that I'm going to be healthy?
Yeah.
And I know that that's so hard for a lot of people.
Yeah. It would be interesting to know, and maybe we should look at this, and I can Google it here in just a second, just to know. We work with so many people that are diabetic, right?
Very true.
And oftentimes we don't know.
Yeah,
I
it's
work
not
with a
something
couple
that you can see.
right, that
Yeah.
will wear a bracelet.
Right.
I'm not sure I would know what to do if something happened to that person that I share an office with. What would be my immediately first response to do? Obviously, call 911.
Right. Absolutely.
But then what do you do to help in that moment?
Especially because there are different kinds of diabetes
That's right.
as
There's
well.
2 different types.
Oh, are there
So
different kinds?
There are 2
Yes.
different kinds, and do you know how to? Okay, I was gonna say
Yes.
I don't know if I should be the one explaining.
And she's
it.
in healthcare. She's almost a doctor. She's nearly
we're
a
getting
she's,
close.
Yeah,
We're getting close.
Yeah, getting close.
So, yes, absolutely. You have insulin dependent, and then folks that do not require insulin. So it's absolutely very crucial that you know what type before you try to have any kind of intervention for that particular patient. So absolutely call 911 would be my first 100% reaction. But then also knowing those different types, and if somebody needs sugar or they don't need sugar. So that's also going to play a vital role
yeah,
in how they're feeling and what's going on, right?
yeah.
I love
Yeah.
that. I love that part you said earlier about educating the young too, because I feel like this is especially important for the younger people who might be diagnosed, but also the education piece is so important for our caregivers as well, to understand like what your medications are, why your mood might change. I mean, especially for somebody that we might serve here at Joy's House, if you have diabetes along with a dementia diagnosis,
Oh, yeah.
those things can be really hard to deal with.
Absolutely. Because you also think of it actually can trigger the nerves, in your fingers and in your feet. And so they can have numbness, just like with dementia. You may be walking around and you have the numbness in your feet. Diabetes can play a major role in that too. So they could be having it, kind of double time, right? Instead of even just that one diagnosis. So that's why they do call diabetes a comorbidity, because it is a disease that plays a vital role in what's happening with the other diseases in your body.
Wow. Interesting. That is Angie Light. She's filling in today for Tina McIntosh. We're with you for a few more minutes. Noah Taylor and Terry Stacy. Do you think that there are some that are just even nervous about getting tested to see, even though they might, because they know that
Absolutely.
They do know about diabetes and they know that what their life is about to change.
Well, and I think there's still a huge stigma with it to where, people are embarrassed. They think that it's something that they've done wrong, and that is not true. Removing the stigma that it's something bad is something we really need to work on as a society and in our families to make sure that they feel comfortable to say, hey, I do have this, and that everybody can love on them in the right way, and that it's not anything to be ashamed of.
Okay. All right. Noah, I think that's going to do us. Angie, thanks for filling in today. You did a great job.
My
Love to have you
pleasure.
back. Before we've got just a few seconds here. Tell us about, you said, you own a business.
I do. So I own Radius 10 and Radius Care, and we have been in business for over 6 years. And we help on the R10 side of really consulting for businesses in healthcare, and then and also recruitment on that side. And then the Radius Care side is fully dedicated to healthcare coordination for families.
Thank you. How do we get a hold of you?
Absolutely. So you can get a hold of us 317-680-6700.
That a girl. She's
or
just giving out random numbers.
www.radius-10.com.
Perfect. All right, everybody. Thanks for listening today. And Noah, you'll take us out.
As we close the show, we'd just like to remind our listeners that they can contact us for more information and resources to help you through the journey of caregiving at joycehouse.org. Caregiver Crossing is supported by Cardon and Associates, with 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living. Cardon is right by your side. Until next time, take great care of each other.